A second here. All right. Well, welcome. So I'll let you maybe introduce yourself before we move into discussing a little bit about your profession, if that's okay.
For sure. My name is Rachel Uniat. I'm an occupational therapist by trade. I worked in the field for about 4 years, 3, 4 years before I started teaching. I started teaching at RDP part-time, and then I still do go back and work in acute care, usually is where I do work, but I still do go back and work quite regularly and keep my skills up. So that's me.
Wonderful. And I think you answered my first question, which is, what is your profession? So maybe could you describe your profession for me? Really thinking about if somebody knew nothing about your profession at all, what would you want them to know or how would you describe it?
You know what? Usually people don't know anything about occupational therapy. They hear occupation and they think that we do therapy related to jobs or work, or they think occupational health and safety. So myself, as well as I teach in the occupational and physical therapist assistant program. We explain what occupational therapy is a lot. So it's something that we definitely go through often. So in occupational therapy, occupation is defined as anything somebody does that gives their life meaning. So that can be things that they have to do to take care of themselves. So things like self-care. It can be productivity, like their work, and it can also be leisure. So basically, we can work in a variety of different settings, but our goal throughout all of those settings is to help somebody overcome any barriers they have to getting back to engaging in their occupations. So self-care, productivity, and leisure, and to help them be as independent as possible.
Wonderful. And for my students who have yet to take their um, labs around self-care, that would be like washing and toileting, eating, and then like job assistance kind of stuff too. So maybe mobility around the job, things like that too, right? Yeah.
Totally. So self-care, we look at, yeah, dressing, bathing, eating, all those basic things, but we also look at more complicated, they call them IADLs or instrumental activities of daily living. So shopping, banking, finances, cooking. Yeah, and then with jobs, it can be return to work, which could mean mobility, it could mean cognition, it could mean work setup. We do have a pretty broad range of, sort of our scope, which is
Mhm.
a blessing and a curse probably, but yeah.
That's true, probably.
Yeah.
So if you were working maybe in an acute care setting or where you have worked in the past, what would a typical day look like for you?
So an acute care setting. So I've worked in a few. My specialty area overall has been neurology. Specifically, stroke rehab is kind of it's my favorite. And I've worked in acute care and stroke rehab. I've also worked in inpatient rehab and outpatient rehab. So I've kind of done like the whole spectrum. So in acute care, a typical day is we get together in the morning as a team and we pull our referrals, and then we basically prioritize and we go see patients on whatever our dedicated units are, and we work on a variety of different things. Lots of times it is ADLs, so bathing, dressing. Lots of times it's mobility, planning. Um, we do a lot of discharge planning and looking if somebody's ready to go home. Can they toilet independently, or do they need some extra equipment? Can they dress themselves, or do they need home care? A bunch of that kind of thing. And then we do have an exercise component as well. Often we assess our patients and come up with an exercise program, and then our TAs, our therapy assistants, carry that out for us. So um, that's kind of our day, and we do bathing assessments, dressing assessments. We walk with patients. So that's acute care. And
Mhm.
then in somewhere like inpatient rehab, we do longer periods of time with each of our patients, and we do more exercises. And occupational therapy usually works more on upper body and cognition. And then we'll work on really functional goals, like their activities of daily living. So we're all about function and being functional.
That's great. What would you describe or what would you say is unique about your profession?
I think something that's unique about our profession is probably our really holistic treatment. So we really think about the physical components of somebody's life, the cognitive components, the mental health, emotional health, psychosocial well-being. We really take a holistic approach to everything, which again is wonderful, but then sometimes it's a bit tricky, right, when you're trying to
Yeah.
kind of broaden your scope.
Yeah, for sure. It can be overwhelming, right? With all of the different aspects, for sure. Yeah. But I
Definitely.
think you guys are like glue too, helping patients get where they need to be, for sure.
I think lots of times we pick up on things that maybe are not in the silos of other professions because we are fairly holistic, and so then lots of times we'll pick up on that missing piece. So that is something that makes me proud of my profession.
Wonderful. So how do you collaborate with nurses? LPNs, RNs, any nursing? Yeah.
Lots of collaboration with nurses in all settings that involve nurses. I mean, we do have work settings that are that nurses don't work in, but I would say at least probably half of the settings we work in, we work with nurses. Um, just being part of an interprofessional team, we're always talking about how the patient's doing, what I often go to nurses and ask about how did the patient do overnight? What's going on that's new with the patient? How have they been moving for you, going to the bathroom? And then the nurses will actually come usually after my session and say, okay, well, how should we be toileting them from now on? What can we do for dressing? So lots of collaboration, not only in rounds, which we often do in rounds, but throughout the day, I feel like I'm often relying on nurses to see what's going on with the patients. I feel like I really value the nurses' opinions because they know the patients, and we typically work like Monday to Friday hours, 8 to 4:15 at AHS, and so we're not there overnight or on the weekends, and so we need the nurses to know they know what's been going on with the patients, and they're so helpful, and because the patients can change so quickly, um, we're I would say there's always like side chats with nurses throughout our day about patient care.
I agree. And collaborating back and forth for sure. We do
For
that lots. Yeah.
sure.
So what would you like the students to know about your profession? What's your like wish list that you wish they would know?
I think that one of the biggest sort of differences with the mindset of nurses and rehab staff, occupational therapists specifically, is that um, we have the goal of helping our patients to become more independent. And whereas I feel like a lot of times nurses, you guys have so much to do. You're getting them ready for their day, you're cleaning them up, you're doing all of this. And I feel like there's not always the time for you to be, like waiting for the patient to do everything independently. So I feel like sometimes nurses are probably wondering what we're doing and why we're letting our patients kind of struggle through their ADLs, when they're getting dressed and when they're toileting. So I think just knowing that that's kind of our overarching goal is to get them as independent as possible. And that's why we
Mhm.
are taking our time and seeing what they would do and really kind of letting them do as much as they possibly can, and then just sort of filling in um, where where they need it.
I think that's a great reminder. You're right, because we do get busy doing lots of things and yeah, sometimes do for patients what they can do for themselves, right? Yeah,
Yeah, and I think sometimes we're probably frustrating for nurses in a bit because we take forever, right, when we're letting the patients do do everything themselves. So I think just that understanding helps us both.
totally. So my last question is just what do you love about your profession?
I'm really passionate about my profession. I love being able to see patient progression um, with, well, like I said, stroke rehab is one of the main areas of my focus when I work, and I love to see a patient, get better and become as independent as they can, and to see them progress from really a terrible point in their life and not functioning well to being as sort of independent as they can is very rewarding. Um, and I also like the holistic component. I really feel like that's a wonderful sort of take on things. And I like that we're able to kind of delve into different areas, whatever the patient might need. So, yeah,
Wonderful. Well, thank you, Rachel. I really appreciate your time.
yeah, thank you.